everyone, and thank you very much for joining us for this event as part of the ESRC Festival of Social Science on the impacts of COVID-19 on the early years childcare market in England. I'm Claire Crawford. I'm a reader in economics here at the University of Birmingham and a research fellow at the IFS. I'm delighted to be joined by my colleagues Gillian Poole from Frontier Economics, Lindsay Trivett, who's Head of Early Years, Childcare and Children's Centres at Birmingham City Council, and Sarah Presswood, who's Manager of the George Perkins Day Nursery here in Birmingham. So I'll just give you a brief outline of the format for today. So the idea is that we will have two hopefully quite short research presentations from myself and then Jill, and then I'll invite Lindsay and Sarah to offer their insights from a local authority and a provider perspective. So if you have short clarification questions about something you've seen, we'll try to take these immediately after each research presentation, but we'll reserve longer and more detailed discussion for the end of the session when we'll hopefully have plenty of time to do that. So if you do have a question, you can type it in the Q&A box, which you'll see at the bottom of your screen. So if you have a question that you'd like to be put to the presenters, then please do use the Q&A button. Whereas if you have a kind of general comment on what's happening that you don't necessarily need to see addressed, you can use the chat box. The Q&A one just allows us to keep an eye on the questions a bit more easily. You can also use the raise hand function, which you can see in the participants screen if you click on that and open it up. And then you can ask your question verbally if I call upon you later in the session. Don't forget the session is being recorded in case that affects your choice about whether or not you want to ask a question verbally. So if you're into tweeting, then you can do so using the hashtag ESRC Festival or SFYS, sofa, Society from Your Sofa, S for sugar, F for festival, YS, and so on. So thank you very much again for joining us, and please bear with me while I share my screen and get my slides up, and then I'll kick off with my presentation. Okay, so this is all about what has been happening in the childcare market in England. And my presentation is going to focus particularly on what happened during the national lockdown earlier this year, as well as immediately after it. So as I'm sure many of you will be aware, during lockdown, childcare settings were only open for vulnerable children and the children of key workers. And so we had a situation where many childcare settings were closed and many fewer children than usual attended those childcare settings. So you can see those 2 points illustrated by this graph. So this plots the number of children attending on the left-hand axis in the grey line, and the percentage of settings that were open on the right-hand axis, the blue line. So you can see that if we think about how many settings were open in the 10 weeks of the national lockdown before the discontinuity that you can see in the figure, it was only around a third of settings were open. And those settings were catering for no more than around 100,000 children in total, which is approximately 5% of all the children who usually attended childcare in term time, and only around 10% of those eligible children, those children of key workers and vulnerable children. Now, after the discontinuity, which marks the 1st of June, when childcare settings could open for all children again, if they wish to do so, we can see a clear jump in the percentage of settings that were open and in the number of children that were attending, which steadily increased throughout the remainder of the summer term, before falling back slightly when the summer holidays started and some settings usually close, and it indeed did do so again this year. But you can see that even by the end of the summer term, it was only around 2/3 of settings that were open, and there were only around 400,000 children who were attending. So still far below the usual levels that we would have expected. Oops. So obviously this enforced reduction in the number of children who could attend childcare settings, and indeed did end up attending childcare settings, the potential financial consequences for those providers was going to be very severe unless the government stepped in to offer some support during that period. And indeed they did do this. So in terms of the support that was available for childcare providers over this period, as many of you may be aware, the public funding for the free entitlement hours, so the hours that are available to all 3 and 4-year-olds and disadvantaged 2-year-olds, in terms of free care in nurseries, the funding for those hours continued as normal. So the idea was that the funding was given on the basis of expected numbers, regardless of whether the setting was actually open or whether the child actually attended those settings. So the public funding for that particular element of childcare provision continued as normal. There were also other schemes that childcare providers could make use of, just as other businesses in the economy could do so. So employers who lost income from parent fees could make use of the furlough scheme, which meant that 80% of their staff costs, which were not covered by public funding, could be met through this scheme. Childminders in particular, who are often self-employed, could access the self-employment scheme, and initially that would cover 80% of their pre-pandemic profits, and then that later fell to 70%. And then of course there were some other smaller general schemes that they could access as well if they were eligible, for example, business rates holidays. So this provided quite a potentially complicated package of support that different providers could access. But of course, an important question as to how effective this will be in supporting them and ensuring that they don't suffer undue financial hardships is the extent to which this is going to cover the different income sources that the providers rely on, and indeed the types of costs that they face. So these 2 pie charts are just illustrating those points. So the left-hand figure shows that around a quarter of income for looking across all childcare providers comes in the form of the free entitlement funding, which we know continued uninterrupted. But then about 2/3 of the funding comes from parent-paid fees. So those fees were potentially subject to significant reductions during the lockdown and indeed afterwards. And it's less certain the extent to which the public funding provisions, the public financial support provisions would cover these. The right-hand pie chart gives you an indication of that for employers that could access the furlough scheme, for example. We see that quite a substantial proportion of the costs that childcare providers are facing come in the form of staff costs. So where the furlough scheme enabled them to cover a substantial part of those staff costs, that will be quite a big help in covering the costs that they would have continued to face over this period. But obviously there's a quarter of the costs that they would have had to continue to make without that large support to help them. So what we wanted to do in this research was to try and understand to what extent providers' finances would be detrimentally affected and to what extent the public support programs would help to mitigate these effects. So we used data from a survey of providers taken from before the pandemic, and we modelled 2 hypothetical scenarios. So one in which we assumed that all of the income that providers previously took in the form of parent fees disappeared, that they received none of that during lockdown. And the second, where we did a slightly less pessimistic scenario, where we assumed that they were able to retain about 15% of their fees. So obviously, the no fee lockdown scenario is definitely going to be pessimistic. The 15% fee scenario was designed to be more representative of the type of figures that were being discussed in terms of both the ongoing fees that they might have been receiving from children who continued to attend the settings, and in terms of intelligence about the extent to which retention fees might have been used during that period. We then took those changes in income and investigated the extent to which the public support programs would cover them. But importantly, we assumed that providers were still responsible for all of their costs, all of their other costs. Okay, so this figure is illustrating the implications of these two scenarios for providers' financial situations. So essentially what we're doing here is to focus on what's called income to cost ratios. So how much income do you have for relative to your costs? So, and we classified providers into three groups on the basis of the different values of these ratios. So we classified providers as being in significant surplus if they had more than £6 of income for every £5 of costs. And we classified them as being in significant deficit if they had more than £5 of costs for every £4 of income. And then we classified everybody else as in the middle. So the significant deficit group is in blue, the significant surplus group is in grey, and everybody else is in the middle. So you can see that the picture that we're getting is relatively similar in terms of both scenarios. So I'll focus particularly on the no fee income scenario. And you can see that under our modelling assumptions, we estimated that around a quarter of private providers, for example, or between a fifth and a quarter of private providers were likely to be in significant deficit during the lockdown period. That was rather lower amongst voluntary providers at around 15%, and then substantially higher amongst childminders. So between a half and 65% of those were estimated to have significantly lower income compared to their costs. But an important way to contextualize these figures is to compare how that looked versus the pre-pandemic baseline. So I'm just going to add those figures to the graph now. So you can see that there were already a significant number of providers in these precarious financial scenarios even before the pandemic hit. So around 10% of private providers and around a third of childminders seemed to be operating in a situation where they had significantly lower income than costs. But of course, it had the lockdown scenario had, as you might expect, quite a dramatic effect on the proportions in the significant deficit categories, with the proportion of private providers in significant deficit more than doubling, and similarly for the percentage of childminders. But a much smaller effect on voluntary providers, for example. So why do we see these differences in provider types? Why do we see this different impact of the lockdown on these different provider types? Well, first is simply the differences in pre-crisis finances. So obviously those who are already in significant deficit are still highly likely to be in significant deficit during the lockdown period, and indeed they make up a substantial proportion of those in the group who are in significant deficit in our no fee income scenario in lockdown, which is what's shown in this graph. So this graph, the total height of the bars shows you the percentage of providers in significant deficit in our no fee lockdown scenario. And then it splits those people into which group they were in before the pandemic struck. So the 11% of private providers is directly comparable to the figure on the previous page of 11% of private providers who were already in deficit before the pandemic struck. And then for most groups, you can see that a lot of the other providers who slipped into significant deficit did so from our middle group of those who were roughly breaking even or making smaller surpluses or deficits. But amongst private providers, actually, even some of those who were previously estimated to be in significant surplus in falling into significant deficit as a result of the lockdown. And that could be because they had high levels of other costs that weren't covered by the furlough scheme, or it could be because they were potentially making large profits from the fees they were charging to parents, such that the amount of funding they received to cover their costs was not anywhere near sufficient to replace the income that they received from the parent paid fees. And the second key reason why there are substantial differences in the financial scenarios experienced by providers during lockdown is because of the difference in funding sources that they rely on. So those who are more exposed to reductions in parent paid fees are more likely to end up facing significant deficits. So this figure is showing the percentage of income that is coming from parent paid fees. So you may remember that the overall figure was about 2/3 looking across all providers. But you can see that for childminders in particular, it's about 75%. So they're highly exposed to losses in parent paid fees. And then private providers are also significantly more exposed than either voluntary providers or nursery classes. And that helps explain why private providers and childminders are amongst the most severely hit by the lockdown scenarios. So just to briefly summarise before I pass on to Jill, it's clear that many providers will have seen a significant financial hit during the lockdown period. Providers that were heavily reliant on income from parent paid fees were perhaps unsurprisingly rather less well protected. And we saw about twice as many private nurseries estimated to be in significant deficit compared to pre-pandemic, for example. But how providers respond to this loss in income is going to depend not only on what happened during lockdown, but also what they believe about their future prospects. So is parental demand likely to rebound? How quickly? And if not, in what ways might they respond to that? And Jill's going to go on and talk about some of the ways in which we saw childcare providers changing their business model and so on in July, so before the end of the summer holidays, which will give us a good sense of the types of ways in which they might be responding. So I'll just give me a moment while I stop sharing screen and allow Jill to take over.
Great, thanks very much, Claire. Let me just get my sheets. Okay. Yeah, thanks very much, Claire. So as Claire just said, that was all about trying to simulate or estimate what we might happen during July. And what I'm going to talk about now is some information, some data we have from a survey that was actually undertaken during July. So just a reminder of what Claire said, that during the first 10 weeks from March 2020, parents were instructed to look after children at home, and childcare settings only had limited open for some children, and only around 1/3 of settings remained open. But from the beginning of from June, settings were encouraged to open for all children, even though government guidance on operational changes remained until the end of July. So what I'm going to talk about in this presentation is some analysis that was undertaken by Frontier from a survey that providers answered in July. So it was during that sort of second period of the initial national lockdown. And this information comes from a survey that was undertaken by NatSen Social Research as part of the survey of childcare and early years providers series, which is funded by the Department for Education. And in this survey, we had responses from over 4,000 providers, and throughout the statistics are all weighted to be as closely to nationally representative as we can. Everything I'm presenting here is from a Frontier bulletin, which is available at the website shown. And that contains a little bit more background information and details than I can present here. And it's quite short, it's only about 9 pages, so it's quite an easy read if you'd like to take a look at that. So I've got a couple of background slides, and they really reiterate what Claire has already said. So I'm going to whiz through these because the first thing I wanted to say was that there were 3 sources of support really for providers during this period. Funding for 3 hours continued. We had the furlough scheme, which partially compensated for lost income from parent paid fees. And we also had support for childminders, although the link between the lost income and the support paid to childminders was particularly tenuous, and there was a very sort of weak relationship between the support they got for their potential losses in parent paid fees. In addition, again, to reiterate what Claire was just showed, that the support and impact varied because of differences in underlying financial models. So there are 4 distinct types, as you've seen. We have the private providers who rely on a mix of parent paid fees and government funding, voluntary settings, which constitute about 12% of all settings, rely on government funding primarily. Another 12% are school-based settings, mainly maintained, but again rely primarily on government funding for free places. And over half of providers are childminders, although it should be noted that they only deliver about 14% of places. So in these statistics, childminders look quite important, but actually in terms of what they provide to children, they have a much lower level of importance. And again, childminders rely primarily on parent-paid fees for their income. So consequently, the school-based and voluntary providers were fairly well supported by the continued government funding. Private providers faced greater shortfalls from their lost parent-paid fees, and childminders faced substantial losses from parent-paid fees, and they had highly variable levels of support. So that's the background. Let me go on and show you what we found from the survey. So the first thing we asked settings was about their reduced hours and indeed whether they were even remaining open in July or not. This graph shows the proportion of settings who remained open, and if they did remain open, whether they had the same number of days open each week and the same number of hours open each week. So the very small red block shows the proportion of providers who were open for more days or more hours. The yellow block shows the proportion who were open for exactly the same days and hours. And then the two blue boxes and the black box show the providers that were open for fewer hours, either through reduced days or through reduced hours each day. And then the grey block shows the proportion of providers who were closed. And across the 5 columns, we've got the 4 different types of providers I just highlighted. And in the final column, we've got the statistics for all providers. And as I mentioned earlier, these have been weighted to get as close as possible to being nationally representative. So the first thing I should just note is a slight technical point. In the survey, it was quite clear that we had a lower response rate from settings which were closed, which was understandable. They wouldn't have been there to answer a survey. So the closed proportion had been adjusted throughout what I present here to be in line with more official estimates of how many settings were closed during the month of July. So overall, we can see that more than half which remained open reduced their daily hours or number of days open. So there were substantial changes, substantial proportions who changed their opening hours, even if they did stay open. And the patterns are similar across all the provider types except for school-based. And they were much more likely to remain open and less likely to adjust their hours if they did remain open. We also asked a question about what providers expected to be doing in September from their position as surveyed in July. And this graph shows the same breakdown as previously, but this is what providers expected to be doing in September. And as we can see, very few providers reported that they were permanently closed in July. And indeed, 96% expected to be open in September, showing that those that even were temporarily closed in July did expect to open again. We also see that almost 3/4 expected to be back to their pre-COVID opening hours or more. And the only exception to that was amongst childminders, for whom quite a substantial proportion were expected that they would be working fewer hours in September. So overall, from the perspective of July, most providers did expect to be returning to something like normal hours in September. We also asked providers what had happened to their child attendance. In particular, we asked them how many children of different ages they would have been expected to have been attending during that July, and how many of different ages actually attended. And this graph shows the proportion of children who attended, the proportion of children who did not attend any setting even though it was open in yellow, and the proportion of children who would have attended settings but they were closed, so they could not attend them. And in this case, the columns show differences across different ages of children. So around 1/3 of children who were expected to attend actually spent any time in a setting. That's the 32% in the final column. Of course, that's not to say that they actually attended for the same number of hours that they would have done, but they did spend at least some time in the setting. 44% did not attend, even though their setting was open. And around 1/4 did not attend because their setting was closed. The patterns across the ages are not so dissimilar, although we can see that attendance was highest amongst children under the age of 2 and lowest for school-age children. And that possibly suggests that children who continued to attend did so for work-related reasons, and that children at younger ages are more likely to be attending anyway because of work, and 3- and 4-year-olds were more likely to have only been in the setting for educational reasons rather than parent work. So what happened to staffing in these settings during July? Well, we asked about staffing among group providers because it doesn't make a lot of sense to ask childminders about staffing. So the use of the furlough scheme amongst group providers open in July was that 47% used the scheme and another 9% who used it previously. So overall, about 56% had used the scheme, which is actually quite a high proportion when you bear in mind that the scheme could only be used by settings which have lost some parent fees, and quite a lot of settings do not have any parent fees anyway. And that was reflected in the fact that the proportion using the furlough scheme was highest amongst private providers, 87% used the furlough scheme, and slightly lower amongst voluntary providers, 61%, and then lowest of all amongst school-based providers, 14%, who are least likely of all to have any parent-paid fees to have lost. We also asked about the number of staff and staff hours that were being used by these group providers in July, again, relative to their pre-COVID situation. And we found that most, 71%, had not changed the total number of staff they employed, but that did include those on furlough. So that showed most had not actually fired or lost any staff. However, 22% had a lower number of staff and only 7% had a higher number, suggesting that there had actually been some staff losses between pre-COVID and in the time of July. In addition, only 30% had the same number of full-time and part-time staff who were actually working. And this suggested there'd been some movement down from full-time working to part-time working within settings as well. So another thing we wanted to look at was what the overall impact on the workforce was. And the question we wanted to ask was, of the workforce that had been working pre-COVID, what were they doing at the time they were surveyed in July? And again, we took all the numbers working and summed them up over all providers to get a sort of total amount for the entire workforce. And this graph presents what the workers were doing in July as a proportion of what the workforce was doing during the pre-COVID period. So what we can see here is in the red bar is the proportion who were actually working. In the yellow box, we had those that were on furlough in open settings. And then we also had the number of staff that had been working in settings that were now closed, and we don't actually know whether they're on furlough or not. So they're simply listed as being in closed settings. And the final column in this graph includes childminders, where we have added in childminders who are open on the presumption that means they are actually working. And then we've got childminders, the proportion of the workforce who are childminders who are currently closed. So what we see is that 61% of the pre-COVID workforce was actually working in July. And that consisted of 55% in group settings and 6% were childminders. We have an estimated proportion on furlough of between 13% and 32%. And that's quite a large range because we don't actually know what staff were doing in closed settings, whether they're on furlough or not at this time. We also see that an estimated reduction in the number employed or working as childminders was between 3% and 26%. We can see that overall there's definitely 3% fewer staff and 3% fewer people working in the workforce from the numbers that have been reduced within the open settings, which we knew whether it had happened. And the higher number reflects that it's possible that those who had been working in closed settings may no longer be employed. So another area we asked about was what happened to providers' income. The survey only asked a limited number of questions about finances, mainly because it needed to be short, particularly in July when providers were quite busy with other matters. As the government funding for free hours was maintained, we only asked how much was lost in parent-paid fees. And we did that by asking them how much providers were expecting to have received in July, and then asking them how much they actually received. And then we can calculate the proportion that they received of what they were expecting. We also asked what proportion of income usually, that is pre-COVID, came from parent-paid fees. And we could use that to allow us to estimate the proportion of total income had been lost due to the lost parent-paid fees. We didn't ask any questions about how much government support had compensated for parent-paid fees. We do know that the furlough scheme was widely used, as I showed above. And we also know from the survey that 79% of childminders had received some type of government support. And we didn't ask any questions about the impacts on delivery costs either. And of course, if there had been impacts on costs, that might have affected financial sustainability in addition to any impacts on income. So the next two graphs I'm going to show on this page show the losses in parent-paid fee income and in total income in July. So this graph is for the loss in parent fee income in July relative to the expectations, what they had hoping to be received. And the black block shows the proportion of providers who received no parent paid fees, where they had expected to receive some. The two blue box and the lighter grey one show where providers had received a proportion of their parent paid fees, either a third, 2/3, or between 2/3 and just less than they had expected. The red block shows they received fees as expected, and the yellow block shows providers who received fees as they would have expected because they were not expecting any fees, so they were never going to be affected. And what we can see here is that most providers receive between 1% and 66% of their expected fee income. The main difference to that pattern is in the school-based providers in the middle row, where a large proportion were unaffected, mainly because they did not have any parent fee income. If we convert that into the estimated total income lost in July relative to expectation, this graph shows the same breakdown, except that it's now for income rather than for the loss in parent paid fees. And what we can see in this graph is that most providers receive between 33% and all of the expected total income. So again, it's sort of shifted up a third. And what that reflects is that even for providers who lost substantial amounts of income from parent paid fees, they still had government funding for free hours or sometimes other sources to help keep the total income level up. Again, we see the middle line is different from school-based providers, as you would expect, that more than 2/3, 67%, sorry, almost all of them received at least 67% of the income they're expecting. So their income sources were largely unaffected during the pandemic in July. So the final slide I want to show you is how confident providers were for going into 2021. And the graph I'm showing here is made up from 3 sources of information. In the July column, we have a simple proportion of providers we observed that were open during July. The September number comes from the question I showed earlier, where we asked providers what they expected they were going to be doing in September. And then we asked another question in the survey, which we asked providers to say, looking forward from what you know in July, how long are you confident, reasonably confident, that you will continue to be operating? And we asked them to pick one of 5 options, sort of the latest point they expected that they could reasonably be confident about still being in business. So, for example, if a provider answered that they were confident they would remain into January 2021, then they were included as being confident here in the end of September 2020 and the end of October 2020, but they dropped out at the point of Easter 2021 and another year or longer. This question wasn't asked to school-based providers because it doesn't make a lot of sense for schools to think about whether they might be closing or not. Now, the problem with this question is that we don't actually ask it at any other time, so we can't compare it to other times. And it's possible that this might actually reflect the normal sort of planning or confidence horizon for providers. However, it is interesting that even in these conditions, a substantial proportion were confident that they would still be operating in at least a year's time, which is relatively good news considering the huge impact they just had. The other interesting point about this graph is how similar the patterns across the 3 types. It does appear that the differences between private, voluntary and childminder providers were not substantial in terms of how they show their future aspects. So in conclusion, and to summarise, childcare provision did make substantial adjustments during the national lockdown. Many settings closed and many settings reduced their opening hours and the time worked by staff, at least in July. It's also the case, as we know from other sources, a high proportion did not attend and potentially missed out on important early education. On the other hand, the financial situation is a bit more positive. The government furlough scheme and support for childminders was widely used. And although there were substantial losses in income, almost all settings expected to be open in September, and around half were reasonably confident they would be open for another year or longer. So looking forward, what does that tell us about the future? Well, I think one thing to note is that the government priority to keep education open during future periods of restrictions suggests that childcare is unlikely to be affected in the same way again. I think the bigger question, again, as Claire has just said, the question is what will happen to work patterns as we go forward, whether there will be long-term changes in work patterns, which then have an effect on the demand for childcare. If it was the case that the provision of childcare was to diminish because there was less demand from, if you like, parental employment, that's not necessarily a bad thing, that's just supply meeting demand. I think the concern comes about whether that then has a secondary impact for the future of early education, whether then that has consequences for child development more broadly. Thank you. I'll stop there. And back.
Thanks very much, Jill. So I'll just pause briefly at this point in case anyone has a clarification question that they'd like to either raise their hand and ask or put into the Q&A. I can see we've got one question in the Q&A, but it's a very substantive question, which we will definitely come back into the discussion, if that's okay. So I'll just pause for a minute in case anyone has a question they want to ask at this point. And if not, I'll pass over to Lindsay. Okay, so I can't see any hands raised at the moment, so I will keep an eye on the Q&A box, so please do keep sending in your questions if you have anything you'd like to add to the discussion. But now I'll ask Lindsay to turn her camera on and so on, and I will get your slides up ready to share, Lindsay.
Thank you. Good afternoon, everybody. I'm Lindsay Trivett. I'm Head of Service for Early Years Childcare and Children's Centres at Birmingham City Council. I'm going to talk to you today about our experience of supporting childcare providers whilst we've been going through the COVID-19 pandemic over the last few months. So I've got a few slides. If we can go to the next slide, please, Claire. First of all, I just wanted to talk about what we do as a council generally. So what we have a responsibility to do, even outside of the COVID period. So we have a statutory duty that covers several different areas, and these are the ones that are relevant to childcare really across the city. So we have to ensure that we have sufficient children's centres. Whilst that's important in terms of an early help perspective, it doesn't relate to childcare providers. So it's still an important one to have there, and you need to know that that's what we do. Most importantly, though, to the audience here today, is that we have to ensure that there is sufficient good quality childcare available across the city, predominantly to support working parents and those that are training to be in work. So Ofsted inspect those providers, but where they're inspected as being less than good, we have a responsibility to work with them to improve their quality at next inspection. And that's where the statutory duty around information, advice and training to childcare providers comes in. We also need to make sure parents are aware of what's available across the city. And we also, as I'm sure you're all aware, safeguarding is everybody's business. So we need to make sure that the providers in operation across the city are well supported in terms of knowing what they need to do if they come across an issue within a setting or the provision that they're offering. And then really importantly, it's not all just about the providers, it's about children as well. So through the early education entitlement with the early education places, we need to make sure that children attain a good level of development at the end of their early years foundation stage. So that's quite important for us as well. Thank you, Claire. Next slide. So I just wanted to give you a little bit of the context of the city. We're quite a large city, obviously, one of the largest, in fact, we are the largest local authority in Europe. I don't think that's changed at all. So as you can see, we have a large volume of providers that are operating across the city. Now, when I talk about providers, I talk about that encompasses childminders, group care providers such as day nurseries and preschool playgroups. We also need to support out-of-school childcare, which is the childcare for children of statutory school age up to the age of 14 or 16 if they have SEND. And then we also, because of the early education entitlement, we also include schools, so primary schools that have a nursery class, and we have 27 standalone maintained nursery schools in the city. So as you can see there, we've got a large volume of providers altogether, just under 1,400 providers in total. What is also useful to know is what the quality level of those providers is. And as you can see in that table, over 90% of all of our providers are operating at a good or outstanding level judgment for Ofsted. I haven't included the schools in there. I can tell you that the 27 maintained nursery schools are 100% operating at good and outstanding. What I couldn't identify was the schools values, because not all schools have an early years foundation stage judgment. The inspection criteria changed a couple of years ago, but it will be somewhere in the region of the similar value. So not only do we have a large number of provision, but we also have a large number of children. So we have, at the moment, these figures are valid from the spring term. So we had 81,500 children aged under 5 in Birmingham, and 64.9% of those are children from a BME background. So you can see that we're a very, very diverse city. We have currently just under 150,000 children that are aged 4 to 14. As I said earlier, we also support out of school provision. So we estimate that around 24% of that cohort, if you like, would require wraparound or out of school childcare. And we base that based on the number of additional wraparound hours that are purchased around the early education entitlement, and we've modelled that across. It's one of the most difficult areas we find to predict demand for is in out of school childcare, but that just gives you a bit of a flavour of that. The last 2 points on here just give you a bit more of a flavour of the diversity across the city. So at the moment, just under 60% of all our early education funded children, so that's the targeted 2s and the 3 and 4 year olds, received either the deprivation element of the formula funding or the early years pupil premium element of the formula funding, which is only applicable to children that live in areas of the highest disadvantage across the city or meet an economic criteria that their parents are accessing qualifying benefits. And another figure there, the 15.9% of children that live in workless households. So that gives you a bit of a flavour of the context of the city. Thank you, Claire. So what have we done? Next slide, thank you. What have we done during the COVID pandemic? So as I said, we're on an ongoing basis, we have a number of support activities that we do as a team to support early years and childcare providers across the city. Specifically, though, during the COVID period, we've undertaken what broadly falls into 2 different types of support. There's been what I would call just normal support and then financial support. So I've broken it down here, and this is just the general support that we've offered childcare providers during this time. So we didn't kick it off straight away. It was a little bit, I've just kind of shared information about the size of the city. When we first went into lockdown, we had done some preparation on really about preparing for a potential pandemic, but we hadn't expected it to kick in as quickly as it had. So we all went from working in an office environment to being home-based. So my 40 people within the team that I manage then went from being in a central location to being disparate across the city. So we didn't manage to get the activities like the consultative group up and running straight away, but we got it up and running within about 4 or 5 weeks. And what we've done is we've met on a weekly basis. We sent out a general invitation to all providers across the city, all of those 1,300 providers, and invited them to attend a weekly meeting chaired by me, but with representatives from my team as well, as a kind of a forum for us to share the support that we wanted to offer and hear from members on what was needed. So we kicked that off relatively early on, and we've had attendance regularly from 22 different providers from across all the different sectors. And it's enabled us to get feedback from the front line on the issues that are being faced day in, day out. And we've been able to share ideas of the things that we thought we could do that would support, but it was then about having that co-design element of, well, this is what we think you need. Is that going to fit the bill? And what do we need to do differently in order to enable that to happen? So the funding package that I'm going to talk about came directly out of the conversations we had there. We also very early on started doing a survey. We started doing it on a daily basis because we wanted to keep a track on. You've just heard lots of information about the numbers of settings that were open and closed. We needed to be able to keep an eye on that because there was the statutory duty for us to ensure that children of key workers and vulnerable children had access to a setting. And the only way we would know that we were able to do that is if we kept a track on the providers that were open and closed. So we started that on a daily basis. We just did a Google survey survey, and then we'd been doing that for about 3 weeks, and then the DFE said we'd like information on a weekly basis. So it's kind of dovetailed into that then as well. But what we also use that information for is it feeds into our website for parents, and we kept the open and closed settings up to date on the childcare directory, so that any parents, key worker parents that were needing to access childcare because their setting had closed could only see childcare in their area that was open. So we used that survey to feed that. I have a team of early years consultants, so EYCs are early years consultants in my team, who ordinarily in non-COVID times are out and about supporting settings where they're needing to have additional input to help improve the quality of the service that they've got on offer, and if there are issues that we then go out and support. So from the get-go in the COVID pandemic, we switched, they weren't able to go into settings. So we switched their remit so that they were open to support all settings rather than just those that were inspected as less than good by Ofsted. But we also made them a direct contact for parents. Now, my service isn't normally a direct contact for parents. We usually support settings who support parents. We provide information, but we don't normally provide a direct service. But we implemented a brokerage survey for a service for parents. So where providers did need to close and they needed to access alternative provision, we had a person on the end of a phone that could help them to do that and would broker that directly with open childcare providers. And through that, we supported, through the lockdown 10 weeks, we supported over 70 families and placed over 100 different children into alternative provision during that time. As it got towards the end of the lockdown period, and we knew that settings were going to be wider opening for all children again, we looked at developing a risk assessment framework. We were trying to enable it to be as easy as possible for providers to get their provision back up and running. If they had been open supporting key worker and vulnerable children, they were more used to the requirements around the social distancing and what they could and couldn't do within the setting. But for a lot of providers that had closed, it was quite a daunting prospect to reopen under the COVID conditions. So we developed a risk assessment framework, and we linked in the DFE guidance, we linked in the early years foundation stage framework and the requirements under that. And we ran a series of seminars to enable providers to access direct support from our team, either on a one-to-one basis or as part of a group kind of webinar sort of session. And as a result of those, we also then developed a number of other workshops which had themes linked into the risk assessments where providers needed a little bit more support. We also during that time had direct contact with providers when they were needing to close. If they had vulnerable children in their care ordinarily, then we were working with those providers to ensure that those vulnerable children were safe, either if they were at home or if they were then placed into an alternative setting. And we kept up regular communications. So I think we did daily communications to begin with, then we dropped it to slightly less frequent, and now we target a lot more what we actually send out. Thank you, Claire. Next slide. So the next element then is the funding support that we offered. So you've already heard about the government-led funding, and some of that is referenced in here. So, for example, early education funding, that was paid for both the spring term and the summer term, or rather from the summer and the autumn term, based on the spring term occupancy. So before COVID hit, not reducing any, because normally early education funding is place-led. If children are in the places, the funding is paid out. If they're not, it isn't. So what we did, government directed, was to keep funding providers at their pre-COVID levels. And we, as an authority, didn't actually move any funding. So we worked with providers to make sure that they were funded appropriately, but we didn't take funding away from where providers closed and children had to access an alternative provision. So that was a national requirement. That's what we were directed to do. But what we then did was that very early on, through the group that I talked about earlier, the consultative group with providers, is that it became quite apparent to us that providers were reporting that it was more cost effective for them to actually close their doors. They could access furlough funding, they could access early education funding, they could in effect stem their losses if they closed their doors and didn't make places available. And that was a concern for us because we have the statutory requirement to make sure that key worker children and vulnerable children could still access provision during that lockdown period. We did a piece of work to look at whether, as an authority with our 27 maintained nursery schools, whether we would be able to accommodate all children within a hub approach using them. And it was very apparent that that wasn't going to be a way around ensuring that we could keep appropriate provision open. So we developed we applied through our command structure that we were operating at the time for some of the COVID-19 budget that had been given to the local authority. And because of the fact that we'd worked with providers and we were able to co-design a package that meant we could evidence the support that it would do, we were successful in securing £3.94 million worth of our COVID-19 budget, which was absolutely fantastic. And what that enabled us to do was providers were able to say if they stayed open, they could access a retainer fee, and it was £300 retainer per week, plus an amount per child. So if they stayed open and they didn't have children coming through their door, then they would still get the retainer, but it meant we could direct parents there. And if they did have children in attendance, then we paid for those children on top at a rate of £100 per week. And what that meant was that it no longer was more cost effective for the providers to close. And because of that, we were able to keep open 62% of our PVI day nursery provision and 36% of our childminders. And that, I believe, is slightly higher than was reported nationally. We have now morphed that. We knew that that was going to be what was needed for phase one. And in our original bid to our governance structure to get that 3.94 million, we highlighted that at the point where wider opening was going to come in, the funding requirements would be different. So whatever we had left after the emergency lockdown period, we'd need to roll into a phase two approach. So out of the 3.94 million, we allocated and paid out in that period of 10 weeks, 1.85 million, which meant we had 2.09 million to carry forward into our phase two. And what we've now developed, again, through that consultative group, is what we're now calling our emergency closure fund. So settings are open, and childcare and schools with early years provision are open. If they are impacted by having to close a bubble or depending on the size of the bubble or a whole cohort, then they can put a claim in to us through our emergency closure fund. And if they've lost fee income or because of a self-isolating member of staff, if it meant they would have to exclude a bubble of children that they didn't need to, if they could just replace that member of staff, then we've got funding available for that. So we put a £7,000 per claim cap on it, but we haven't capped how many times a setting can claim. So with the budget that we've got available, we've got 299 possible claims that can come through. We've also paid free school meals. All children in schools get that. We've also reflected that through to early years, and we've also supported providers to access, and we've signposted to the relevant teams within the council to access the business rates and the discretionary business grants. So we've tried to tap into the biggest broad range of financial support that there is. Thank you, Claire. Next slide. I'm not intending to read through the next two slides, so you can put them up and kind of flip them on as you want to, Claire. But it was about how do we know that the support we've done is right? Well, I think the main thing is that because we've had that consultative group running, we've co-designed quite a lot of the support that we've offered. So we've listened to what the sector have said. We've put forward ideas of what we thought we could do. We've shared that with them. They've then come back to us and we've tweaked and amended stuff. But that, for me, is the one reason why we were able to secure that funding in the first place, because we were able to demonstrate that it would make an impact, and this was what the impact it would make. And then as a result of that, we've had some great feedback come through, and these 2 slides are just some quotes from different providers that we've had, and from a parent who accessed the brokerage support as well. So and that feedback that we've received is from the support that we've offered across the board, so the non-financial support as well as the financial support. But I think the COVID-19 budget that we've been able to access has been really, really positive. And I think for me, one of the best things that I've noticed as we've progressed through the last 10 months is that we've had a really good open and honest dialogue with our sector across the board, and I think that's been a really key important factor. The last slide, please, Claire. So just ongoing challenges. I think these have already been touched on, particularly by what Gillian was saying earlier. For us, our ongoing challenge is going to be around sufficiency. So the impact on sustainability and therefore sufficiency. Before we went into the COVID pandemic, we were in a position of having quite a significant oversupply across the city, and our sufficiency assessment that we were just about to complete our annual refresh was showing that quite clearly. We're now revisiting that before we do anything with it, because we think that the COVID impact will be quite significant. Things like changing parental working practices, whether with increased home working, whether people will still access childcare in the same way. That's something that we need to assess. So we've got live at the moment two surveys, one for parents, aimed at parents and how their demands for childcare is changing and has changed, and one for providers, which is touching on some of the work that you've already presented, Claire and Jill, around the whether providers think they're going to be sustainable and for how long. Because although we have this COVID budget now, that's not a long-term solution. We don't have funding on an ongoing basis. So we need to try and understand that position now. And then the other concern for us particularly is around children's outcomes. And I touched on that at the beginning. You know, there are a lot of children that had lost weeks of participation, and what we don't know yet is what the impact of that is, although what we're being told is that that will have a particularly a big impact. It's believed to be significant. So one of the things that we've done is that we're doing some specific focused work across the city and joined up with our other support teams within the council on speech and language, so speech, language and communication, because that's quite central to ensuring children's outcomes are good. So that's quite critical, and we're doing a lot of work on that at the moment, and it's being rolled out across the city, and it's aimed at taking a universal approach to then lead to more targeted support. And then the final thing that I've put on there around ongoing challenges is a bit more short term, and it's about whether the Department for Education are going to say the same thing for January with the new spring term, whether they're going to allow us to fund in the way that we have been this year, or whether we will have to then go back to reflecting actual participation, and that will just have a further impact on the sustainability if it reverts back. So I think that was everything from me.
Thank you very much, Lindsay. So I'll stop sharing my screen and I'll hand over to Sarah to give us her perspective. That was really fascinating insight into what I think is often an underappreciated role of what the local authority does in the childcare market. Thanks, Lindsay. And over to you now, Sarah. Thank you.
Hello, so I'm Sarah Presswood. I own and run a private day nursery in Birmingham. So just to give you provide a perspective on what it's been like operating through the pandemic, we did remain open right from the get-go. So this has sort of been the our experience from those very early stages right through to now. And I think initially it was the utter lack of guidance that was a challenge around how to operate, and the associated fear about the risks of doing something wrong when there was such a high risk of disease around us. I think talking to other providers, it was an overwhelming sense of being left to blunder our way through that complete unknown. There initially was a confusion and tension over being told that we were an essential service, but not feeling supported at either a local or a national level. We were required to stay open for vulnerable children and key worker families, and yet no one was offering us any help with how to do this, from no guidance to no support with accessing PPE, or even telling us whether we needed PPE. Alongside that, as a business, we had a genuine concern about how sustainable we would be. So it was really good to know early on that the furlough scheme was available to us. And then, as all the other speakers have spoken about, so the furlough scheme and the government commitment to continue paying the nursery education funding at pre-pandemic levels, those two income streams felt like lifesavers at that point. So we felt we could stay open and survive, but at that point it all just seemed to get very messy. There was conflicting guidance on whether we could use the furlough scheme and continue to receive government funding. And it just seemed to take forever to get an answer on this point. The Childcare Minister herself made a statement that the sector could rely on both sources of funding. And I know many nurseries had taken the decision to close and furlough all their staff. And Lindsay made reference to the fact that at one point it did feel much more financially sensible to make the decision to close. And it was only later, when the distinction between being able to furlough staff in the proportion of your private income versus funding, that was made very clear, that settings started to realise that they'd actually been wrong to close and furlough all their staff. And to give you a bit of an indication for us as a setting, I know you've had a lot of national stats, but in the spring term, the split of funding for us was 38% funded and 62% private fee income. So that was the split that we were able to do in terms of our staff and furlough. And then because of the shortfall in the private fee income, so 62% of our income was from private fee income, we were then debating whether we should ask parents to pay fees or retainers, because obviously we didn't feel it was fair to ask them to pay for a service that we weren't providing. But also there was that sense of we need to remain sustainable so that when they do need us, we're still here. At that point, demand for our service from key worker families was at about 10% of our normal income level. And so we were very conflicted between staying open at that level and yet trying to do the right thing for families. So we thought we'd reach out to settings that were closing around us and offer childcare places to their key worker families and vulnerable children that still needed places as a way of sort of justifying staying open. That in itself brought issues because we couldn't have children in with their parents for their usual settling in sessions. So that felt like an additional pressure and strain, certainly for the staff that were working through this period. I think it was about this time that the dialogue did start with Birmingham City Council, and Lindsay has already mentioned that it did take a few weeks to get that sort of weekly task force provider session going, but it was really, really valuable when it did. And there was a group of providers and members of Lindsay's team, and we sat down and really threshed out what were the issues and the struggles that we were facing. And it was great that they actively were open to find ways to support us. So that sustainability funding that Lindsay's already talked about, was actually turned around really speedily once the system was up and running and the dialogue was there. And it was really felt to be a great encourager for those settings that had stayed open. So I think alongside the business concerns were the concerns for the staff about them becoming unwell and how to cope due to the lack of flexibility in the furlough scheme, because of needing to furlough staff in blocks of 3 weeks. And yet we were working with families, often doctors, and who were on variable shift patterns. So the demand was changing week by week. As Lindsay has said, they were surveying providers on a daily basis just to understand the changes in demand. We coped basically by the few of us that worked by just working whatever hours we needed to keep things up and running, and by covering every role in the setting, from cooking meals to cleaning, because we had, in order to save costs, we had got rid of our cook and our cleaning contractors. So then the next challenge was the wider opening in June, and this finally brought some guidance. And although that was welcome, the way we were then expected to structure the nursery with bubbles, keeping children in groups of children in set rooms, brought its own issues around staffing, the numbers of children that we could accommodate, the fact that we needed to clean in between having different groups of children in. It just meant that staffing became very expensive, because if someone was off, you couldn't just say, oh, you're not working or you're not busy in that group today, you can go and work in there. We had to keep staff consistent for fear of breaching bubbles, so to speak, and then risking the contamination of more than one group, and if a positive case was identified, and having to close down to far more children. I think at this point the challenges seemed to be coming very thick and fast. We'd been in a very long, protracted debate with our insurance company, and although we were convinced at the time we did have cover, they were very much dragging their feet. It was about this time that the Competition and Markets Authority ruling on nursery providers shouldn't be charging high levels of retainers or fees to parents came out, and that felt like another blow. We hadn't gone down that route. We had in April asked parents to make sort of donations to help towards sustainability, but beyond that we hadn't charged anything. But I know other settings were then in the position of having to make refunds to parents. Things then are in the guidance that dictated we couldn't have parents or visitors into the setting, meant that, at this point it would be when we would normally be expecting to look to build up our occupancy for the coming year. So we couldn't have those prospective parents and families into nursery to see what we were doing. So we were doing things like virtual tours and weekend visits and things. But again, that's additional expense. You're paying staff to work at the weekend. And I think as we've sort of come into more recent times since September, and numbers have picked up, it's that need for isolation of children and staff if you get positive cases, meaning closure of bubbles, that's been of greatest concern to settings. So again, it was really useful to be working with Birmingham City Council at this point, where this second tranche of funding that Lindsay's referred to around the emergency bubble funding, we've come to affectionately refer to it as, so that if you had to close a cohort or a bubble, you could rely on this funding. Again, has felt like a great lifesaver. Last few bits around sort of demand. Into September, demand for places was very slow to pick up, and we were considering short-time working for our staff. But over the last month, demand has really increased. But interestingly, the profile of demand is very different, and I think it reflects some of the slides that we saw earlier, that it's mainly younger children, the families of younger children that are looking for childcare. So this term, our split, if we were doing it on actual numbers, would be 20% funded and 80% private fee income. So that's quite a significant change from where we were in the spring. The main difference has been a lot less families accessing the 30 hours funding and just generally less preschool children. I think a few positives out of this. Working in bubbles has actually benefited children in terms of closeness of relationships and opportunities for deeper engagement and interactions. We actually did some research with the children around how they felt about the bubbles, and the main messages that came from that were that it was the relationships with attuned staff that helped them cope with the challenges of being in the bubbles, and that also they felt more secure in smaller groups. And I think sometimes free flow, overwhelming choice isn't necessarily good for all children. Staff have reported that working in small, consistent groups has enabled them to build those secure relationships and to support deeper engagement with children. They, along the similar lines to what Lindsay's just reported, have noted higher levels of need amongst the children in terms of reliance on adults, lack of independence, and generally children are a lot more emotionally dysregulated than we would perhaps normally expect to see. I think my final comments are on what perhaps could have made it all easier over the last 6 months or so. Definitely some more timely guidance, clarity of guidance, guidance not changing quite so much. I mean, just the last week with the new second national lockdown, Wednesday, I think we got guidance and it was all about no visitors, no new children into the setting. But by the time I woke up on Thursday morning, that changed again. So I'd yet again, all those parents that I'd put off, children I'd stopped coming in, I could change it. So that's not helpful on top of everything else. I think really a level playing field, parity with schools in terms of access to PPE. We are providing education. We're told we're an essential service. We're lumped in with schools when it suits government, but then treated like private businesses when it suits them to see us like that. So access to PPE and testing, schools received additional funding for cleaning and things. So all those additional costs have really had an impact on profitability for us. So that's basically our take on how we've been through the pandemic period.
Thanks so much, Sarah. That was absolutely fascinating, especially to hear about some of the more kind of on the ground impressions, especially from the children, and understanding how their kind of development has continued, and the fact that actually maybe some of the changes might be good for them, even if the overall situation is forcing them to struggle a little bit. I was also really interested to hear about your situation with the attendance. I'm just going to share my screen again. I just so somebody asked in the question and answer session about the where the attendance statistics came from. So they're the Department for Education statistics, which the data that Lindsay will have been collecting from her providers will have fed into. And this just extends that graph I showed you earlier to show the picture right up until last week, basically. So you can see that obviously there was a kind of the first half of the graph, if you like, is what I showed you earlier with the pickup up until the summer holidays. Then we can see a dip in attendance and in terms of the proportion of settings open during those school holidays. And then, as Sarah was describing, a kind of increase in attendance and in the proportion of settings that were open once the new academic year started. But not kind of, it is a bit difficult to compare these autumn term figures to the overall figures across the year, because obviously lots of children will have moved into school and their places won't yet have been entirely filled by new children starting, but still significantly fewer children in attendance than is the case if we look across the whole year, even right up until recently, and that chimes very much with what Sarah was saying. So I'll just take that away. So we've got one very challenging question to answer in the, or at least one very challenging question to answer in the comment boxes. If there's any other questions, please do include them in there. So I'll just pick up on one question from Christine Merrill, which I also was thinking of asking Sarah, which was whether you are planning to retain any of the changes you've made over this period, for example, the working in smaller groups with the bubbles going forward, or whether you think you'll revert once the kind of guidance is relaxed a little bit.
It's a debate that we've been having as a staff team, and I definitely think there are elements of that smaller group working that we will look to retain. It's especially as I think we underestimate the impact of the lockdown and things on children at our peril. So having understood that relationships and attachment attunement is so key to helping them feel supported, and if facilitating that is through small group work, then that's the way we've got to go. But I think we have to understand there's a cost implication to that. I've got 2 qualified teachers who could be on a 1:13 ratio, but that's not what children are needing right now.
Thank you for that. So one of the other substantive questions that was raised in the Q&A box was about the possibility of large-scale closures or failures in the childcare market. I can see Lindsay's answered from the perspective of Birmingham in terms of being in a position of oversupply before the pandemic, which is really interesting. And I think it is generally the case that there is quite a lot of turnover within the childcare market. So there's quite a lot of providers entering and exiting each year anyway. But I guess just picking up on that and relating to the figures Jill showed us about the prospects that providers feel looking forward, how confident they are about remaining in business. I wonder if either Lindsay or Sarah or Jill have any insight into how those figures might compare with a normal time. So I think Jill's figures suggested maybe a year from now, half of providers would be kind of fairly confident about remaining in business. Is that the kind of horizon that you would be familiar with working towards as a childcare provider? Is that the kind of horizon over which you'd look? Do those figures chime with what you know pre-pandemic, or do they look a bit worse than you would have expected?
So from Birmingham's perspective, our turnover has been really quite low over the last relatively recent number of years. The number of providers that we have a turnover in, we don't get that many. I couldn't give you the exact percentage, but we do have that information. I just don't have it at my fingertips. Yeah. But we ordinarily, particularly with group care providers, childminders less so, we get more of a turnover in childminders. But with group care providers, that we've had quite a static market for about at least the last 3 years or so. What I would say though is that we are at this moment in time, one of the questionnaires, the surveys we've got live at the moment is with providers. And we are asking that question. It is very much about how are you feeling about your sustainability now moving forwards, so that we can get more of an insight into that now, so that we know roughly what we're dealing with. But even now, I would say the number of closures that we're getting coming through, because we get direct information from Ofsted, are minimal. The large majority of providers are still operating right now.
Okay.
I think,
and I guess
I was just to say, I think what will be key, having looked at the change in demand for us, will be government funding for next term. I know that's a question we've debated quite a lot, Lindsay, at our recent meetings and things, and a concern around that, and also the adaptability of settings. So we're already, although we're optimistic-ish, it will only happen if we can adapt our offer. So I'm looking at providing more places for children under 3 right now, but that does have a cost implication because of ratios.
Yeah, I mean, the only thing I would add to that is I was quite, from our survey, I was quite surprised how optimistic it looked at the time from July. How optimistic providers were about how long they could remain in business. Given the conversations that were going on in July, I expected really more dire numbers than that. And I think what's important to remember is that a lot of providers are operating sort of around the break-even level, aren't making huge profits, and are offering dipping in and out of profitability, as we saw when we got quite high proportions in Claire's numbers, who, strictly speaking, look like making a loss, but that's not a permanent thing. You move in and out all the time. So they're always slightly on the edge. And the other thing I think to remember is that the sector has adjusted to a lot of changes over the last few years anyway, in terms of particularly in government policy, the changes in the free entitlement policy and issues around the funding of the free entitlement in the last, that I think it has become taking a general overview, become quite a flexible sort of responsive sector to what's thrown at it, and it's a bit used to living on the edge. So maybe the numbers aren't so surprising that they were so optimistic about, you know, the coming year or so. And I you know, that's a huge credit to the people who deliver this on the ground as well.
Yeah, absolutely. Thank you. And I guess just picking up on that, there's one question in the that's come through, which is about the impact of all this on the staff in the sector, and whether this kind of situation is going to make it harder to retain highly qualified staff in the early years sector. I wonder if Sarah, you want to comment on that from your own perspective, and then I can ask Lindsay and Jill to comment from yours as well.
I think staff retention historically has just been a massive issue. And I think looking forward, one of the big unknowns on the horizon is the next hike in the national living wage and the impact that that will potentially have on providers. And I think, interestingly, Gillian, that's one of the things that causes us to dip in and out of profitability and things. Oh, gosh. Who knows, really? It really is a hard question. I think in some ways it has made people realise how important the role that they're doing. So it's those soft benefits really that have come to the fore. You're never going to do this if you want to get rich quick, but if it's in terms of a fulfilling role and seeing the difference that you're making to young children's lives, then that's good. And I guess alongside that, the national living wage does help, but as a provider, that's a double-edged sword, I suppose.
Yeah, thank you. Jill or Lindsay, do you want to add anything on that front?
I was just coming in and say that in a number of conversations I've heard the term, or possibly I've applied it, that childcare is now seen as a key sort of almost part of our infrastructure, that it underpins the economy as well. So I think that's been brought to the fore by the fact that it's been taken away, and people have seen what happens to employment when you do that. You know, there is a realization that it is part of what helps drive all the rest of the economy as well. And therefore it does have much more a key role, key national support role than just a private choice by individuals.
That's exactly the point I was going to make. The fact that, and I think Sarah, you said it in the presentation you gave, that childcare providers have been lumped in with education and schools throughout the whole of the support that DFE and guidance that DFE have been putting out. And I think that's been really beneficial, because it has put childcare providers up on a parity with that key service that schools provide. And I think that has done a lot to raise the profile. The fact that early years and childcare workers were also designated as key workers has been really beneficial. And it's something that we as a local authority are taking away and looking at what can we do to support the workforce. That's something that we've already identified as an area we need to look at.
Thank you. There's quite a specific question in the Q&A box, which I think I might ask Lindsay to answer in direct response to the participant. If they would like to write privately in the chat box who they are, we can respond to you directly. But I'll just finish, if I may, by asking each of you. So obviously we've got a spending review coming up. We don't know what's going to happen in terms of funding for the sector going forward, either in terms of public funding, whether this intention to move back to funding based on attendance in January will go ahead. What will happen to the furlough scheme once the national lockdown ends beyond the period that's already been announced? If you could have kind of one plea put into the government as to what would help make your life, the lives of your lives easier, or the lives of the childcare sector easier, what would it be? If anyone's got a burning thing that they'd like to speak, you can unmute yourself straight away. If not, I'll maybe come to Jill first, if you don't mind, and then Lindsay and Sarah.
Okay, I'll give a chance for Lindsay and Sarah to think a few minutes longer. I think really that going forward, we still have the issues we had before the COVID pandemic, and that's it's the old triangle about affordability, availability, and good quality. And I think COVID, I mean, maybe I'm being optimistic again, will pass, and we've still got to be thinking about those issues. So I think my plea for the government is to think, okay, you want to support childcare. Let's think about what type of childcare you want to support, and recognise that what type you choose affects how much you're going to have to pay to get it. That would be my advice.
Thank you very much, Jill. Lindsay, do you want to add anything?
There is nothing, that is absolutely nub of the issue, nail on the head. That is, from my perspective, it's about saying if childcare is, and early education is important and vital, then we need to make sure that we're not trying to do it on the cheap, that it's got to be funded appropriately, and that would be my biggest plea, and give us some long-term, long-termness of that. At the moment, we've got no guarantee of any of the early years funding more than the current financial year that we're in, because we're waiting for that spending review that should have happened over 12 months ago, that will give us some longevity. So that's my plea.
Yeah. Anything you want to add, Sarah?
Quality costs, I suppose, and just status. I think it goes with, being lumped in with education. On the one hand, that feels harsh, detrimental, or an afterthought, but actually some parity of status about the impact early years practitioners have on the lives of young children, and we're looking at outcomes here. Then status, give us some status, but then status will cost as well, so fund it better.
Thank you very much to all of you for your contributions today. I hope you'll agree that it was a really fascinating discussion. Before we finish, I just want to take the liberty of mentioning a project that myself and Jill and some other colleagues who I think were in the audience earlier, if they aren't now, Jane Lewis from CEI and Ivana Lavalle, are doing with the Nuffield Foundation, which is going to look at, in particular, the role of local authorities in the childcare market, and to think about, in particular, the kind of support that they've provided during COVID and what impact that seems to have had on the local childcare markets, and what lessons we can learn from that about, I guess, future levels of support. So that's just to kind of watch this space for more research from us coming out on this topic over the coming months and so on. So let me thank all of you who've joined us this afternoon as well. It's great that you were able to give up some time this afternoon to come and join us. If you know of colleagues who might be interested in what we've said, the video from this session will appear on the University of Birmingham's YouTube channel after this, and you can see on the chat box a link to an evaluation if you would be happy to fill that in to give us some feedback about how you enjoyed the session, or otherwise, hopefully you enjoyed the session. So thank you very much to other panelists and attendees, and hope you have a good rest of the afternoon. Thank you.